a benefit for the company itself and the employee. It's a win-win for everyone. It's the company helps kind of market that, hey, this is, we take care of our employees. We bring in an on-site physical therapist, and that helps with the employee retention. People want to stay. I got a lot of people telling us that.
Let's jump over to wellness, on-site corporate wellness, physical therapy. So your practice, it was busy, it was thriving before COVID. Your therapist, setting up dates and times to kind of have blocks of times in different Manhattan corporate buildings. So it would be like a specific employer. They would have, I don't know, like a gym area or like some wellness area or something. You'd bring like a portable treatment table, you'd bring some portable equipment, whatever. Is that kind of how you describe it? Like on-site wellness or
Yes.
wellness, physical therapy, or what's like the definition of it, or how do you describe it?
Yeah, definitely. So we describe this as an on-site physical therapy, or you can sell it as the corporate wellness program that includes physical therapy, and different other services such as chiropractic and acupuncture, different other services. But mainly, speaking of my side, it's the physical therapy part that I do, where I bring in my treatment table and I bring in my PT supplies, like low-tech stuff, and we work obviously on site with companies that provide us with a small, either an office or either a conference room, or some companies have some gym or a nice gym space that they can offer the services at. And we've seen it all ways. And basically they bring us in on a weekly basis, 1 day per week for, X amount of hours. And we schedule clients or people who are interested. They reach out to us. We provide an email address where people can schedule for physical therapy, and then they come and see me in that conference room with it's just low tech, all mostly manual therapy, therapeutic exercises. When we treat basically pains and aches and just neck pain, back pain, like all the simple stuff, like sports injuries, that stuff that can be done in an office space versus an actual gym space or a rehab area.
Yeah, just regular orthopedic diagnoses and conditions.
Yes. And definitely if there is a need for more advanced treatments or more rehab based, we can either refer them back to our office where we have a brick and mortar not too far from that company where people can come in and see us there as well. Just to kind of, if they need maybe more treatment more than once a week, they can definitely see us there.
Got it. So, but it was disrupted during COVID, obviously, when people like March and April of 2020, like pretty much a lot of the corporate offices were closed. People were working from home. And then since then, 2021, 22, 23, now 2024, there's been a slow migration in New York City. I don't know how it is in other cities. I'm sure it's similar, where there's been more of a push to get back into the office, but there's still a lot of companies where their employees are like working from home like Monday and Friday, right? Or they're going into the office 2, 3, maybe 4 times a week.
The trend is Tuesday, Wednesday, Thursday right now. That's the trend. People work from home Monday and Friday.
Which is a pretty sweet deal. So you get to work from home. You're home, 5 days out of the week now, which is kind of wild. How about any like tips or strategies for therapists in other cities, other states, that if they have, and you don't have to be in a city, right? You could like find some corporate office, a corporate park where there's like one or more employers. If someone's watching or listening that wants to like potentially get into an employer, regardless of their size, like, I don't know, like maybe they have 1 floor or 2 floors, like they don't have to have like 10,000 employees or anything like that necessarily. So what would be like a tip or strategy for a new therapist or a new practice owner to get into an employer like what you've done? Is it cold messaging the HR professionals? Is it just luck? Like you have to have a current patient who works for some employer and it's relationships and good luck and word of mouth, or
I think this is how it started with us. I would say luck, but what we say is that we've always built rapport and relationship with patients who come to our office. And in New York City, you can have a brick and mortar in Manhattan, and you get people coming from all these companies around you to get physical therapy treatment. And this is how it started with us, that by building this relationship rapport with some corporate execs or decision makers and companies close by. And we kind of explain the idea that what we do, and I wouldn't say sell them, but we just kind of tell them that they can conveniently get these type of services and can benefit other employees in the company from these services. And that's one way we've done it. So by building relationship with some decision makers and HR employees. And once we've built a portfolio, we've been doing this since 2013, and we built a large portfolio of companies that works with us. And once you have that, then there's other ways to kind of like attract more organization, more companies to sign up for the program, such as LinkedIn cold messaging or targeting the HR leaders or decision makers in companies and things like that. And for this to work, what I noticed is that you got to have a portfolio. People have to see that you've worked with companies and you've got reference, and they can actually reach out to the HR person in that company and make sure that this program the liability is limited, and there's so many factors that gets into it. And obviously, when you build a relationship with a patient who brings you to the company, they know you, they trust you, they've been seeing you for a while. They know that there's no catch or no extra cost to the company. So they're really just trying to benefit, their other colleagues from it. And yeah, there's multiple ways. I mean, practice owners can benefit from this.
When you reach out to the HR representatives or head of HR or any of the C-suite executives, whoever you might reach out to, do you mention like this? Obviously, it's an added perk or benefit to your employees. They can, you accept out-of-network insurances, so they already have it on their plan. You knew that up front before you kind of go in there.
Yes.
So obviously, the approximate reimbursement for like a 4-unit visit. So obviously, that's a consideration. And then when you reach out to these potential decision makers, do you also kind of frame it as like, this is a perk and a benefit for your employees who we might be saving them time and effort? So like their options would be they go to an outpatient office to get any type of therapy, musculoskeletal treatment, manual therapy, whatever it is. Another option would be the other off, like my practice or your home visits or my home visits, which is still an option. Or what you specifically are offering to them, which is you go to them, let's say, whatever you have available, Tuesday from, 10 a.m. to 2 p.m. or whatever block of time, or maybe it starts with like a smaller block of time, but you pitch it as this is a benefit for your employees who can get treatment, hands-on treatment on your floor or in your office.
Yes, and that saves on the productivity,
which goes into they'll be more productive because they don't have to travel to some place. It'll creates efficiencies for them, which then kind of get passed off to the company. That employee might feel better. They get maybe they get revitalized. They feel better in the short term or the long term. Maybe they're now a little bit more productive of an employee. Maybe they stay on site at that office.
So this is, it helps employee retentions as well. So so there is definitely a benefit for the company itself and the employee. It's a win-win for everyone. It's the company helps, kind of market that, hey, we take care of our employees. We bring in an on-site physical therapist, and that helps with the employee retention. People want to stay. I mean, I got a lot of people telling us that big part of they don't want to leave, that they know that they are taken care of medically, or they have this chronic condition that they're getting treatment for, and it helps with employee retention. And obviously, like you said, it's the lost productivity that people, when they go to PT place, it's, trip there 15 minutes back and forth, and the treatment is 45 minutes or half an hour. That's like 1.5 hour, 1 hour right there. So it's definitely a win-win for everyone.
Awesome. So that's the challenge, though, is if someone's a therapist, a practice owner, if they don't have the portfolio, like obviously if you have a portfolio, you have references, it's so much easier to get that 7th, 8th, 9th, 10th employer, right?
The most difficult one is the first and the second account. Yes, those are the most difficult one to get. But once you get one, it's easy to go up from there. And it's also, there is one part is that if, let's say you get one company and you start working with some of the employees there who are also, can one day leave that company and go to another company and they work with, and they know about you and they know about the program, and these employee now can become your marketing, word of mouth lead marketing, and they connect you with their new company or new job. And then you got another opportunity right there.
Right. When you have some critical mass, then were you still the one delivering a lot of the treatment, or you also then had some other staff physical therapists actually doing the treatment at 9 or 10 different employers? Like there's no way that was all you, right?
No, we've grown to, we had three full-time physical therapists under our management, and they would go on site to different companies. And I used to also treat also before the pandemic. Like I enjoy treating patients, and I enjoy engaging with them. And I had some admin work that I had to do, and I had some time devoted to that and the management part of it. And I had also my hours where I treated. So I've done it both ways. But yeah, hiring is always the way that you can expand to more companies and more days.
And with the on-site corporate wellness physical therapy, you did this, you and your partner had been doing this for years. And this was before you had the brick and mortar office in Columbus Circle where I did treatment with you.
Yeah, that was before that. But during the pandemic, I had to pivot a little bit. But we had another brick and mortar close by Flatiron District in New York City. And unfortunately with COVID, we had to kind of shift and kind of close for a while. And then I chose to, to open that brick and mortar up in Columbus Circle area.
Got it. So the current practice, the brick and mortar in Columbus Circle is Peak Dynamics. And then is the corporate wellness PT, is that a different name or different practice?
Oh, it's different practice. We had a partnership. It's called Flatiron Physical Therapy, and my business partner and I, we both serviced all the on-sites through that company. And we're out of network, and both in Peak Dynamics and Flatiron are both out of network practices. And yeah, we've been doing it that way.
Got it. Any other tips? I think it's kind of like just brute force, right? So like to get that first contract, to get that first on-site corporate wellness contract, you'll have to maybe speak to your attorney or whatever for some legally, like some forms and whatever, either the practice has the employer sign or the employer might need you to sign some things in terms of like liability or whatever.
Yeah. Yeah, that's a big part of it. It's the liability part that most of these companies, once we get in front of the decision makers, and hey, then that want to bring to the employees, then it goes to legal. Before once it gets to legal, they want to see a COI for the business. They want to see that that there's no liability, or the coverage is usually they require a very high coverage for the business. So definitely that's something that we ran into. But again, I mean, it is definitely worth to invest in such policy, because you're getting now into this building where you're going to have the exposure for all these new patients. So I think it's definitely worth the investments. So yeah, definitely that was one of the main questions that we get asked all the time. Are you guys insured, licensed? We need to see a proof of COI and things like that, and we have to show them that. Yeah, and again, like I said, I mean, the beauty of it, it's only one sales pitch that you do. And instead of going out there and attracting one patient at a time, rather than that, you just, you're doing one sales pitch for one organization, and you get exposure to all their employee base. So that's one of the biggest benefit of this model. And
let's say someone landed a contract, so they just got their first employer. Maybe they figure out dates and times or whatever. How does that therapist, that practice, go from one or two or three employees to a full day of employees being treated? Like, are you able to influence the HR person to kind of put it in like a company-wide email? Are there, is there signs, things that get printed and you post them in the office? Or, I mean, obviously word of mouth might get around, but like can't really, word of mouth is not really like predictable per se. So like, how do you go from one or two employees to like 8 or 10 or multiple days of employees?
Yeah, no, definitely. Great question. So typically there's an internal marketing that happens through the HR channels. They send massive blast emails to all the employees in the company, and they say, hey, we have an on-site physical therapy services happening now, and to schedule, call or text or email such and such and such. And we start getting the inquiries that way. And then we start to kind of sign people up and put, take their demographics and things like that. But yeah, another way of marketing it is by doing a mini health fair that is just sponsored by us there. So what we do is we go there and we set up like a nice table with some, healthy snacks and things like that. And people just come by, and there's an email that goes out that say, hey, Peak Dynamics Physical Therapy or Modern Physical Therapy are here, and they're actually, talking to people, doing some posture screenings, they're giving out some healthy snacks and things like that. Hey, just check them out. And people start to come by that area, and they talk to us, and they get like one-on-one conversation with me, and we kind of talk to see if they will benefit from from signing up for each of the services. And that's another way of marketing. And then you got the best way, which is the word of mouth. They tell their colleagues, and they kind of start referring each other. So that's always the best and the cheapest marketing way.
Right. Okay. So health fairs, let's say,
Yeah.
What if there are no health fairs offered by this employer? Let's, you and I, we know some of these like crazy law firms that
they don't, yeah,
they're just maniacs, right? So,
yes.
or it's like hedge funds, or I don't know, there's some other big employers in the city, like, there's Google, there's LinkedIn, there's, like Venmo, there's like a ton of other companies. What if they don't have any health fair, health screening, whatever? Do you suggest like you reach out to the HR person and you offer like to stop by at like a certain day and time, and maybe you can ask them to, and just totally for free, you ask the HR person to maybe send some email blast or something, but you like go, and it's almost like you're creating your own mini health fair or something. Maybe you take blood pressure, maybe you're doing just neck soft tissue work or neck mobilizations or something, or Theragun or whatever, like whether people like that or not or whatever. But could you brute force your way in there if there's no health fair? It's like you can offer your own mini like taster sessions to some of the employees. What about that?
Yeah, so I feel like I've done this, but again, it's also has to happen through, I wouldn't say a health fair, but it's going to become a mini demo session evening. Sometimes we call it this way. When one of the ways where if there's a lot of interest or things dried out a little bit, I would definitely suggest that to the HR that I would bring in my table and do some posture screenings. We do that through a really cool app that we do. We just take pictures for the individual and just kind of scan their posture, identify where is the upper cross syndrome, lower cross syndrome, etc.
What's the app? What's the app that you use?
We use an app called Posture Screen.
Is it free or paid? I'm just curious.
There is a free version of it, and there is, I think now they have it that you have to pay for a subscription or something like that. They have a static screening and they have a dynamic screening. So you can just simply ask the person to do a mini squat and just kind of like analyze their muscle imbalances, for example, out of that. And the app helps you get there. And I would do stuff like that, and a couple of minutes of Theragun and things like that. And people just get a little demo of what we do.
Awesome. Any other last considerations or tips or tricks for potentially trying to get into on-site corporate wellness? I mean, I know we gave a lot of examples of what you've done, what's kind of worked, and maybe things that don't work, but any last comments around this?
I think if you look at the time right now, I think this is, especially post-pandemic, I think this is the ideal time. I look at it this way for companies to attract people back into the office. So, and at least I know for New York City, this is the direction right now, and companies are kind of like, at least on a hybrid model where people can come into the office 3 days a week. And I think there is, yes, as much as COVID or the pandemic kind of like disrupted that model, I think now that we're 4 years in, I think there is a better chance for practice owners to kind of like get in front of these companies that wants to attract more employees back into the office. And I think practice owners can start with their patient base right now and just kind of like gauging what is their work mode right now. I mean, if and they kind of like start giving them a little pitch about what is these on-site services can entail, and if they are open to connect them to their boss or their HR leader or decision makers in the company. And I think this time is a good time for that, to kind of start out there. And like I said, it's only about that first account. It's only about.
So to review, we kind of touched on it earlier, but like The pitch to the employer side or the HR C-suite would be, we can provide on-site hands-on treatment,
Physical therapy.
and physical therapy to your team members, your employees. If they feel better, they're going to perform better. They're going to have better productivity and perform better. Their output, their productivity is going to be better, whatever it is, whether it's LinkedIn, Google, Venmo, any other, law firm, hedge fund, whatever. The output would be better by offering it on site. It's an efficiency for the employee. Maybe that employee spends an extra hour or two in the office per week just because of that. In that extra hour or two, maybe there's some additional benefits to the employer in terms of output and productivity or whatever, instead of that employee that has to leave work or go to a doctor's office, go to a physical therapy office, whatever. So that's kind of like the pitch to the employer side. Also to the practice side, there's no rent, right? So there's low overhead.
There's no rent. There's no rent. Yep. And there is no cost for the company because you're simply going through the employee's health benefits. Basically, it's as if they came to you, but you're just literally, going to them and provide it on site. And there's no rent, obviously. And that's the only thing that the company has to provide. Just a little space, a wellness room. Most of these companies has a dedicated wellness rooms for various reasons, or simply could be just a small conference room. That's all what the company has to provide. Yeah.
Right. Dr. Ahmed Nady, thank you so much for your time. What's a good place, whether it's your website, LinkedIn, email address, what's a good place for the audience to reach out to you if they want to learn more and ask any questions or touch base?
Thank you. Yeah, of course. I can be reached at my website at peakdynamicspt.com. They can also email me at peakdynamicspt@gmail.com. I'm happy to answer any question for your audience.
Awesome. If you guys find this valuable, helpful, go ahead and subscribe to the Dave Kittle Show on the YouTube or iTunes or Spotify, whatever it might be. Dr. Ahmed, thank you so much.
My pleasure, Dave. Thank you for having me.
You're welcome. Hey, it's Dave Kittle. Are you a healthcare business owner or physical therapy practice owner who is looking to figure out your succession plan or exit strategy? We might be able to help. And in fact, we may be interested in acquiring your practice. If you're interested, you can reach out to me. Shoot me an email at dave@conciergepainrelief.com. That's DAVE at CONCIERGE painrelief.com. Or you can call me at any time, 646-781-8884.